My name is Tim Hagerman. I'm a public health inspector here on the infectious disease team. I have the pleasure of introducing Redora Lalo. Redora is an IPAC specialist with Public Health Ontario. Prior to joining PHO, Redora worked in infection control for 15 years in various healthcare settings across the London area. Her strengths are in the areas of policy, program development, education, and she's strongly committed to collaborative practice. Redora has maintained certificate in infection prevention and control since 2008. So thank you very much for coming and presenting for us, Redora. We really appreciate it.
Thank you, Tim, for the introduction, and good morning, everyone. I'm glad to be here today to present on fall preparedness planning. And as Elaine mentioned, it's really more important now than ever because of the increased number of influenza and other respiratory viruses, aside from COVID, that we really prepare for this coming respiratory season. So before I go over the full presentation, let's go over the objectives for this presentation. So by the end of this session, participants will be able to identify and implement the key components essential in preventing respiratory outbreaks, as well as incorporate the provincial guidelines into their home's fall preparedness plan. In preparation for potential outbreaks of infectious disease such as COVID-19 and other respiratory viruses, long-term care homes and retirement homes should have developed or reviewed their outbreak preparedness plan. So for this presentation, we'll go over first the organizational risk assessment as well as surveillance as important components of your fall preparedness plan, and then go over and review the outbreak preparedness components of the plan, and then provide available resources for you at the end. So organizational risk assessment, what is organizational risk assessment and why it's important? I'm sure you probably heard about organizational risk assessment for the last 2.5 years. It is a systematic approach to identify risk, whether it's internal to your home or external to your home, the likelihood of that risk occurring, and the impact to the home or setting. This assessment also includes when the risk is acceptable and if measures in place are sufficient. An ORA can help provide framework for your infection prevention control components of the outbreak plan. So think about and consider the risk and impact of COVID-19 and other respiratory viruses to your residents and staff, and consider the effectiveness of your present control measures. Are there any changes that need to be made to manage outbreaks effectively and efficiently? ORA, as of course the name implies, should be conducted on an annual basis to reevaluate action plans and ensure that they are effective to prevent the spread of infections or outbreaks. So there are 5 steps in completing your organizational risk assessment. So you can see on the image here, your first step is to identify the risk. So who can be exposed and how they can be exposed. So again, think about your vulnerable patients, whether their exposure is coming internally or externally. This is followed by analysis of the risk. What are the current measures in place and what are the current control measures in place? One of the things that you can do here as part of your analysis is conducting audits to identify and address the gaps. Third on the steps is assessing the risk. What is the likelihood and impact of the risk, and think about the impact of health and quality of life on your residents, families, and staff. Fourth is managing the risk. So think about your control measures in place, such as your engineering controls. Do you have policies and procedures in place? Are there training and education for your staff, even your families, caregivers, volunteers, and visitors? And lastly, reevaluate the risk. So this is a continuous process, continuous evaluation and monitoring to ensure effective measures are in place. So as I mentioned earlier, IPAC audits is part of an ongoing risk assessment and is a valuable tool to identify and assess your current measures and identifying gaps in practice. As you're all aware, as per the minister's directives, licenses shall ensure measures are taken to prepare for and respond to a COVID-19 outbreak. And for this year, it's the other respiratory viruses as well, including development and implementation of an outbreak preparedness plan. And part of this is conducting your regular IPAC audits, of course, in accordance with the current ministry guidance documents. Homes must ensure that, as part of the current ministry guidance documents, homes must ensure IPAC audits are done every 2 weeks unless you're on outbreak. When a home is on outbreak, we know that audits must be completed weekly. Homes are reminded that the IPAC audits must be done um, and rotated across shifts. So that would be your evenings and weekends as well. The COVID-19 self-assessment audit tool for long-term care and retirement homes can be used as part of your IPAC audits. There are additional audits that are available, such as your personal protective or PPE auditing, as well as your hand hygiene auditing and environmental cleaning audits. Another important component of your IPAC program is surveillance. I'm sure probably some of you or most of you have attended the long-term care webinar series from Public Health Ontario, and that's one important component that was discussed there. It is key in identifying new clusters or new cases of infections in your home. So what is surveillance and why do we do it? So surveillance is a systematic, ongoing collection and analysis of data with timely dissemination of information to those who require it in order to take action. So for the IPAC leads and for the homes where a surveillance program is essential in including your data and providing that to the decision makers so they can make the change based on the information that's provided. It is important as it allows the early identification of illness and potential outbreaks. So this will provide prompt initiation of appropriate infection control measures, of course, to prevent further spread of illness in a care setting or a home. With regards to surveillance, surveillance involves daily monitoring of presence for new signs and symptoms, as well as exacerbation of signs and symptoms. And this can be done by your staff, designated staff, or from clinical notes from physicians, as well as reports from residents themselves. Through regular surveillance, you'll be able to sudden increases or unusual increases in illnesses and respond accordingly. There is a good reference from IPAC Canada, the Long-Term Care Surveillance Toolkit. This was developed in collaboration with Public Health Ontario, as well as IPAC Canada, and you can use this, or you're probably using this already within your IPAC program. So within after that organization risk assessment and surveillance, we now go to the review of the outbreak preparedness plan. As I've mentioned, this coming season, we have to anticipate and be ready for co-circulation of influenza, as well as sort of COVID-19 and other respiratory viruses such as influenza, rhinovirus, as well as respiratory syncytial virus or RSV. So these are the key steps in outbreak preparedness, and mentioned as per the minister's directive, homes shall ensure that they are prepared to respond to COVID-19 and other respiratory viruses, ensuring the development, implementation, and yearly review of your COVID-19 outbreak preparedness plan. The outbreak preparedness plan includes identifying members of the outbreak management team, including identifying the person who will lead that outbreak management team, identifying your local public health unit, as well as the hub and contact information. So have that ready on hand so that in the event of an outbreak, you're ready to report the situation. Updating and reviewing of your policies and protocols. For example, policy supporting staff to stay at home if unwell. Frequent and ongoing communication to your staff, your caregivers, volunteers, as well as, of course, your public health unit. ensuring there are sufficient supplies of personal protective equipment and testing kits, as well as a plan in place for testing, collection, and sending it over to the laboratory. I know later on in the session, there will be a discussion about testing and sending it over to the lab. This also includes IPAC training of all staff, volunteers, families, and caregivers, as well as regular audits of the home. So as you get prepared, so this is just a list of your members of the outbreak management team. So of course you have the home staff, you have your lead for the outbreak management team identified, your administrators, managers, infection control designate, of course, environmental staff, communication staff. And your local public health unit also forms part of your outbreak management team. And this may also include the local IPAC hub. There are also services that that you have to identify that should continue or suspend in the event of an outbreak. So, such as your medical care, routine medications, mental health support, and counseling. There should be a plan in place for your residents to have access to key services and supports if they cannot leave the home during outbreak of COVID-19 or other respiratory infections or viruses. As another key components I've mentioned are your policies and procedures and protocols. So those policies and protocols must be reviewed and reflect current best practice guidelines and recommendations. And these policies are your vaccination policy for COVID-19, influenza, and other vaccination requirements for your residents. Have a visitor policy and ensure policies and procedures are communicated to all types of visitors. Think about, do you have policies and procedures, or have you reviewed policies and procedures for cleaning, environmental cleaning of residents, when there are additional precaution, when you're an outbreak or a non-outbreak situation? Is there a healthy workplace policy and policy that supports staff? Do you have policies for appropriate testing, collection of specimen, and such as nasopharyngeal swab or rapid antigen testing? Next one too, which included on your policies and procedure, is your medical directive. So prepare medical directives ahead of time for your antiviral medication, of course, in consultation with your medical director. So ensure there's means of consulting with your medical director regarding assessment for treatment of COVID-19 with Paxlovid or antiviral, and initiation of antiviral for influenza during outbreaks, whether it's a treatment or prophylaxis. Ensure that you update any changes to your policies and procedures, communicate that with your staff. If there's any changes to your organizational structure, such as your team lead for your outbreak management team, that it's well communicated ahead so that everyone know their roles and responsibilities. So in terms of communication, ensure that there's a process in place for communicating with your staff, essential visitors, residents, families, and including the media for external and internal communications. Think about, does your home have an outbreak management communication protocol to connect with families and residents, other facilities in your area, or the media? There should be an established communication process between the outbreak management team as well as any patient family or advisory committee or council. Additionally, plans are in place to put up signages as a means of communicating to anyone coming into the homes during outbreaks, notifying them of the current situation. Another important aspect of outbreak preparedness is the testing of residents in the event of an outbreak or an ongoing testing based on the ministry requirement. Testing of residents, healthcare workers, and other staff and essential visitors is performed as according to ministry directives and current guidance for testing. Also ensure that there are adequate supply of your COVID-19 testing kits, as well as kits for other respiratory viruses. Policies and procedures must be in place for collection and transport of laboratory testing, as well as education and training of COVID-19 and other respiratory viruses specimen collection. I'm sure the public health unit will be able to assist you in the event of an outbreak in terms of collection, the residents that need to be tested, as well as transport to the lab for testing. We'll now go over the infection control measures that should be in place as part of your outbreak preparedness plan. And this is, of course, prevent and minimize transmission of infections as well as outbreak. So your infection control measures that should be in place or already currently in place is your screening and monitoring, staff and client and resident education, your PPE, and equipment readiness, admission, as well as implementation of precaution, environmental cleaning, and ventilation. So we'll go over each one of this section of infection control measures. So with regard to screening and monitoring serves to identify those who are infectious to prevent potential spread of infection within your home setting. There are two types of screening. As you can see here, you have your active screening, which is either performed by a screener through paper screening, through an app, and that's an attestation of their signs and symptoms. For residents, they are screened on admission or arrival to the care setting, as well as daily monitoring of staff. Again, daily monitoring of residents, again, for prompt isolation and implementation of infection control measures. With regards to passive screening, there are signages on entrances for staff, visitors, and volunteers to self-attest for on their signs and symptoms. There's also information on what to do in the event that they fail the screening. So these are important measures to prevent anybody coming into the home care setting who are ill and symptomatic and may potentially spread respiratory infections to the home. Another important component is, of course, your education, and I'm sure this is an ongoing process in your home settings. There should be a plan for ensuring staff, including your agency staff, to receive proper infection control training. There are online training available through Public Health Ontario, and I know Elaine have already put a plug on that. There are many educations and webinars that have been put together, and you can find that on Public Health Ontario website. We just recently launched a new online learning page, which is a repository of all the infection control modules that have been put together by Public Health Ontario. So there are modules for healthcare providers, modules for non-clinical staff, as well as other modules such as food processing modules. There are also modules for families and caregivers. On your side, ensure the following information are included on the education, such as hand hygiene, physical distancing, personal protective equipment, point of care risk assessment, when to initiate additional precaution, as well as your respiratory etiquette. With regards to admissions and transfers, again, this is following the minister's directive. Long-term care homes shall ensure that the detailed requirements and information related to admission and transfer into the home, including requirements for testing and isolation, are followed as set out by the guidance document. There are, of course, detailed information in that document, including non-outbreak and outbreak periods, testing and isolation, and considerations for vaccinations. We all know that while homes are no longer required to directly set aside beds for this purpose, where possible, single rooms must be used for residents requiring additional precautions, such as those with suspect or confirmed COVID-19 or other respiratory viruses. So plans should be in place in terms of cohorting residents and staff during outbreak, especially with reduced isolation beds. Additional considerations, of course, for your residents are your mental health and emotional support, as well as maintaining social interaction while they are in the home or care facility. Another important aspect is your environmental cleaning. So it's an important infection control measure for any types of disease condition, of course, not just during outbreak, but all throughout the year. Environmental cleaning policy and protocols must be reviewed and include policies for routine cleaning and during outbreak situation. Also ensure you have adequate supply readily available for cleaning, and your disinfectants have the drug identification number. It's important that the disinfectant that you use is one that's approved by Health Canada, as well as policies that allow for the surge capacity of environmental services staff. Ventilation has been one of those multi-layered approach infection prevention control measure that we all have heard through the last 2.5 years. We know that indoor settings pose an elevated risk for COVID-19, as well as other respiratory infections. Improper or insufficient ventilation has been frequently reported as risk factor in outbreak investigation. As part of this multi-layered approach, ensure that you have proper ventilation of indoor spaces. And there's combination strategies that you can include: your natural ventilation, local exhaust fan, your central ventilation, use of portable air cleaners, and of course, maintenance is important here. Maintenance of your HVAC system must be done on a regular basis to ensure that you have the proper ventilation of your indoor spaces. We've mentioned in other sections about your supply. So, of course, you ensure you have adequate supply of your personal protective equipment. Additionally, your alcohol-based hand rubs, your testing swabs and kits, your cleaning supplies, as well as your signages, so that you're ready in the event of an outbreak. And you have good placement of your personal protective equipment and alcohol-based hand rub as part of your point of care risk assessment. The ministry's recommendation is to keep a 4-week stockpile of your personal protective equipment based on high transmissibility and low clinical severity scenarios. Inpatient setting should have planned for volumes that are 8 times what would be normally used in a 4-week of an influenza season. So with the coming respiratory season and the prediction that we are going to be seeing influenza again and other respiratory viruses as well as COVID, we really need to ensure that we have enough supplies, that we keep enough supplies for our staff as well as for our families and visitors. So lastly is your human resources and staffing. So a contingency plan to meet appropriate staffing levels with support from your leadership should be in place. Contracts in place for staffing, agency partners, availability of alternate staff such as non-clinical staff and volunteers to assist homes in activities such as meal and transport, and supporting the mental health and well-being of your staff is of course essential, and I'm sure all of you have already have that in place and are just in the process of reviewing and ensuring all these measures are in place and available for staff, visitors, families, and caregivers. So lastly, I just want to provide you with these different resources here from Public Health Ontario as well as the ministry. So we have several documents with regards to your outbreak preparedness plan, control of respiratory outbreaks in a long-term care setting, the testing prioritization and testing information, and that is from your from Public Health Ontario Laboratory. We also have, as Elaine mentioned earlier at the beginning of this session, the Ontario Respiratory Pathogen Bulletin, where you can see cases and information and data about influenza, as well as other respiratory viruses. And then the Ontario COVID data tool has been updated to include a section on influenza as well, so you can find not just COVID-19 data, but your influenza data as well, including outbreaks from different public health unit jurisdiction. That concludes my presentation for today. If you have questions, this is the information, an email that you can send it to. And I just want to mention, Tim, if they can think of any questions after this session, since the presentations will be sent over to them, they can always connect with Public Health Ontario for additional questions or anything they might be able to think about, any clarification that they need about the presentation. And again, most of this were lifted from the new ministry documents, as well as the Public Health Ontario checklist for long-term care.